Okay, well, are you ready to go? Should we just jump right in? Hello and welcome to the Let's Make Them Pay podcast. I am your host, Scott Bennett. Today, a very special guest, Dr. Sophia Yen. She is the CEO and co-founder of PandiaHealth.com, is board certified in pediatrics and adolescent medicine, and has more than 20 years of experience in the medical field. She started Pandia Health because she's passionate about women's health and wanted to give them a break from the month-to-month pill anxiety that comes with being on birth control. Dr. Yen, thank you so much for being with us today.
Thank you so much for having me. I'm so excited.
It's an absolute pleasure. Let's begin with your company, Pandia Health. You specialize in delivering birth control directly to women by mail. Can you walk us through the basics?
Yeah. So I was giving a talk to a bunch of doctors about 12 years ago. Why don't women take their birth control? And one of the top reasons was didn't have it in their hand. And my friend and I looked at each other and were like, oh, we could solve this. We will just ship it to women and keep shipping it until they tell us to stop. And then we ran ads, free birth control delivery. And 60% of the people that responded to such an ad did not have a prescription. And thank goodness I'm a doctor. And I was like, fine, I will write your birth control prescription. And so thus Pandia Health was born. If you have a prescription, we deliver it. We bill your insurance. Thanks to the Affordable Care Act, Obama, Biden, no copay, no deductible, AKA free. If you have insurance and your insurance didn't opt out for whatever reasons, religious reasons or something like that. And then if you need a doctor, it's only $35 once a year to use our expert physicians, and unlimited follow-up because we didn't want anybody to run out of birth control because they couldn't afford the follow-up visit. So the goal is just never have to run to the pharmacy, never run out of your birth control. And I came up with an algorithm for picking the best birth control pill on the first go, with 93% of our patients happy with the first pill prescribed, and then 82% of people who are new to the pill patch ring still on it at a year, thanks to that happiness and the delivery. And each package comes with candy or something delightful.
That's fantastic. Yeah, I mean, I've only experienced birth control through my wife, but I know that for her, that was a real concern. Was getting the next month's supply on time was always a pain in the neck, and yeah, it's such a needless hassle. So it's so great that your organization is here helping facilitate that and make things a little easier on everybody.
Yeah, thank you. And then just to add on, when I hit menopause, all of my friends were like, menopause. And I'm like, yes, I will find the best treatment for me and I will give it to you. And so in building our 100% physician team, we had 2 OB-GYNs with 20 years experience in menopause each. And I was like, you are developing the protocols. You will teach all of us. And if any of us have questions, we will ask you. So we see our birth control patients in 1 business day, and we see our menopause, perimenopause patients in 3 to 5 business days in case we want to consult our super menopause experts.
I love that. That's fantastic. Okay, so this is mostly a political show. So what I want to know is, what's changed since the Supreme Court struck down Roe versus Wade in 2022? Are these post-Roe restrictions affecting Pandia Health and access to birth control nationwide?
So we are seeing the beginning of a slippery slope, the beginning, or not the beginning, but a lot of implementation, right? Was it Project 2025?
Yes.
Or whatever the year they put on there. And they're starting to equate birth control, which is emergency contraception, and IUDs, intrauterine devices. So preventing an unplanned pregnancy, preventing abortion, with abortion. They're calling 2 things that are used to prevent abortion. And it's like if you don't want abortion, 1, give people free prenatal care and free health care and make this option a good one and an affordable one, and give people birth control and good sex ed. But to label 2 birth control that emergency contraception is your last chance to prevent a pregnancy to label that abortion, you're just like messed up, you know?
Yeah.
And so important for people to know that emergency contraception is not the same as an abortion pill. If you are pregnant and you take emergency contraception, nothing happens. You just wasted money and time. If you want to terminate a pregnancy, you need to get medication abortion or surgical abortion. And medication abortion is very specific. It's mifepristone and misoprostol, though they're trying to take away mifepristone, so we may just end up with misoprostol, which is not as good. So that's, one horrible thing. The other horrible thing is we all tried to stop the Attorney General Blanche from being put into place because he said he was going to implement the Comstock Act. And if people don't know about the Comstock Act, this is from 1873. Before any of us currently alive. The Comstock Act prevents you from mailing lascivious things in the mail or whatever, and they're defining anything that could help an abortion to be that. And if people don't realize, abortion is not just used in medical terminology. Abortion can be a spontaneous abortion, which lay people know as miscarriage. But if a spontaneous abortion or a medication abortion or a therapeutic abortion goes awry and there's stuff left over and it doesn't complete, then sometimes you have to do a surgical abortion. So the Comstock Act could be used to apply to even surgical implements for a surgical abortion if somebody has a miscarriage or an ectopic pregnancy that needs to be terminated. All of that technically is abortion. And the other side doesn't care. They're just like totally screwing women left and right. And so what the implication of the Comstock Act is that people cannot mail abortion pills, which has been a huge thing in all the states that have made it illegal. And that also potentially, if they're defining emergency contraception as abortion, then my company comes into play because we're mailing birth control to people. We're trying to prevent abortion, prevent unplanned pregnancy. That's like my purpose in life. Nobody should get pregnant unless they want to get pregnant. But if you don't want to get pregnant, please let me help you.
Yeah. So there's that, but it also seems like birth control itself is maybe the next target that they're going to go after. Where are we at in that situation?
You have to watch out. These people have a slippery slope. If you hear any mention of emergency contraception as abortion, tell them that the science actually shows the active ingredient in the over-the-counter emergency contraception is a progestin. And do you know what we give women that have recurrent miscarriages to prevent them from having a miscarriage, aka abortion? We give them progestin. So it's not an abortifacient. The way it works is if the egg hasn't popped out, it's like whole bunch of progestin. And so then the body's like, oh, I'm pregnant. Why would I pop out another egg? So it's not an abortion. Abortion by medical definition is egg and sperm have hooked up and it's stuck to the side and it's growing. And not until it sticks to the side do you even get a positive pregnancy test. And so scraping it off, that is an abortion. And emergency contraception does not scrape it off. Emergency contraception prevents the egg from popping out or it prevents the egg and sperm from sticking. And so therefore it is not an abortifacient.
Okay. Well, thank you for explaining that. But let's go back to the end of Roe versus Wade. Do we have any kind of numbers for women who have died or become permanently disabled because of these new anti-abortion laws that are being passed?
Yes. So as you know, people are very cautious about reporting abortions and abortion numbers. And it's hard to track the exact number of deaths because there are individual cases that are attributed to other things for privacy or just, for safety of the doctors involved. There are at least 12 specific big cases that have been put out there, and there's been estimations by the Hopkins Population Center of about 59 excess pregnancy-associated deaths. However, I think the data is by taking the right to abortion away, how have women suffered? And what we've seen is a 50% jump in sepsis rates amongst women in Texas. This is taking us back to the 1970s when there were wards, hospital floors filled with women with pus just coming out of their uterus of sepsis. And at the time, all we could do was hold the woman's hand and pray. And now we can give her antibiotics, but like, this is the game they're making doctors play. Like, I love this quote by somebody on social media. They're like, women have to edge death. And doctors have to be like, how close to death will it cover my butt so that I don't lose my license, I don't get sued, and I don't get put in jail. Right. So it is ridiculous that women have to edge death in the parking lot. How much blood does she have to lose? How much heart rate does she have to go? How many bacteria have to be swimming in her blood? And two of the remarkable cases were in Georgia, and Georgia even investigated it and said if we didn't have these whack laws, they didn't say that, but you get the idea, these women would not have died.
Right. Well, just in this modern day and age, to have women who are suffering, medical emergencies, hemorrhaging blood, and they're sent back out to their cars. Like it's just it's so crazy to me that this is happening. But this is what
the one that really pisses me off, in addition, that just makes no sense, is an ectopic pregnancy is a pregnancy outside the uterus, and it's usually in the tubes. And there's just no way that that's going to survive. It will only grow and eventually pop, and the woman could bleed to death. Like, why? You shouldn't have to wait for that to happen. We should be able to act as soon as we know that is there. Right.
Right. But that's where we are right now, where even ectopic pregnancies are treated like viable pregnancies, I guess, because the law is, it's just, I find it so exasperating.
Yeah. Even when you know as a physician there is no opportunity to save this pregnancy, but there's a, quote, fetal heart rate beat or something like that. And that's not even necessarily a medical term, some electrical activity going on. You can't touch that lest you risk losing your license or going to jail. Wow.
So as a doctor, I mean, are you hearing any stories from the medical community that, that have anybody in your orbit touched this kind of thing?
So there are definitely the activists that are being proactive and making sure that no matter what your state says, you can get a medication abortion. And so definitely check out the website, plancpills.org, or I need an A, the letter A, you know what the red A, but not that A, but abortion. I need an A.org. And then there's the National Abortion Federation. And then I want people to know about national abortion funds, because there was this literally poor, but also sad young woman, I believe she was like 10 to 13 years old, sexually assaulted. And her mother and her agreed the best thing to do would be a termination, but the mom didn't have time or money to take a day or two off to take her to a different state. And I'm sure that if we had known, we would have sent out the bat signal and we would have all been like, donate to help this girl, don't make her suffer through. But because they didn't know about this NNAF, National Network of Abortion Funds, the young woman was required to carry this thing, and she was actually kicked out of school because the young women around her, the girls around her, were freaking out that their classmate was growing pregnant with a rapist baby. And just like insult to injury, like you were raped and now you're kicked out of school and everybody knows, and like you are miserable for the rest of your life. And it's just like, if we had just known, we could have sent out the bat signal and got you the money and moved you. But it takes knowledge and it takes money to do this when it just shouldn't. Like if we had gotten to her, no, she was raped. There was nothing we could have done. This was, we needed legal abortion. But medication abortion can be used up to 10 weeks or 12 weeks. And for people to know, if you go to the emergency room right now, they can't tell the difference between a medication abortion and a spontaneous abortion. And a spontaneous abortion is a miscarriage. So all you need to be like, I was pregnant and now this happened, and by law, they got to take care of you. But there are, again, the crazy states that are putting women in jail for a miscarriage because they think it's the other. They think it's medication abortion.
So So it's a case of assuming that they're not innocent until proven guilty, but perhaps guilty and have to prove their innocence. That this is a how do you even prove that there's a miscarriage? There's no way to do that, is there?
Well, you can see stuff on ultrasound if there's an incomplete miscarriage. You can also check the blood. Sometimes it takes a while for the HCG to leave your blood level. And that is how we follow if somebody had a spontaneous abortion, is that instead of the HCG rising as in normal pregnancy, we see it going down, or how we actually know an ectopic, because an ectopic is not growing the normal way, it's growing a different way. And so we follow the HCG. But know that if you do medication abortion and you have a complication or whatever, and you go to the ER, there's no blood tests right now to tell the difference between a spontaneous abortion and a medication abortion. And technically, legally, they're required to take care of you. But if they don't have an OB-GYN who's trained in what's necessary to help you, that's a problem. And a lot of doctors are not a lot. It's decreased by about 3.6% the amount of physicians that are applying for OB-GYN, internal medicine, family medicine, emergency medicine, anybody that might touch a pregnant woman, because they don't want to deal with this.
Yeah. So, no access to abortion in 13 states now. How are women coping with this? What's it look like out there?
So my husband's joke is everything that's bad for the world is good for my company. So COVID, horrible for the world, but great for telemedicine and for people understanding asynchronous telemedicine. Dobbs. Horrible for anybody who believes in bodily autonomy, religious freedom, etc., but good for Pandia Health, because women realize, I need to get my birth control under control. I need my birth control automated. I need my birth control foolproof. So you've seen a lot of women get IUDs. You've seen women get implants. Implant, actually, this is whenever I give my lecture on the top best birth control to the least based on efficacy, it blows my mind that the implant beats vasectomy. Vasectomy is the gold standard, and something in a woman's arm for 3 years looting out hormones beats vasectomy. That's kind of awesome.
That's amazing.
The IUD with hormone beats tubal ligation. And I'm again like, this is, I love this little prop. You take out an inch on each side. It used to be just snip, but then we're like, people are fertile. So they take out an inch on each side and they burn it. The fact that anyone could still get pregnant after that, your body really wanted to be pregnant. But the IUD with hormone beats snip, snip, burn in a woman.
Amazing.
So I was like, this is some good stuff. And it's reversible. But if you're done, then do the permanent thing. But know that the implant and the IUD with hormone beats the hormonal IUD. And then comes the copper IUD. Then comes the shot. Then comes the ring, the patch, and the pill. And it's simply how many times you can mess up.
So the pill's in last
the
place?
Ring is well, because you have 365 days you could mess up, right?
Yes.
Whereas the patch is once a week and the ring is once a month. The shot is every 3 months. Yes.
Gotcha.
Exactly. And
well,
that's make sure people know about Plan C pills and I Need A, and know that it's roughly $85 for a medication abortion. You can get it ahead of time. So I might strongly suggest that, because if the Supreme Court is going the way they're going, if Comstock is going the way they're going, these people will no longer be able to mail these things.
Yeah.
So you might want to get it before you can't get it. And that applies. The crazy part that Comstock people need to realize is no matter what state you're in, this is a national law. So those of us who think we're safe in California and New York, we will not be safe.
Wow, that's troubling indeed. So surveillance now, flock cameras are so big. Are women, is this being used to track women against state lines for abortion access cases? Are these cases is this really, is it to that level now?
I haven't seen a case with flock cameras, but know that your phone is tracking you. And and I went to MIT, And I have friends that work in forensics. And if it was ever on your phone, if it was ever on the internet, they will find it. Yeah. Even if you stomp on your phone and you throw it in the sea, if you synced it to the internet or if it synced itself to the internet, it is out there and it can be found if it wants to be found. So I know one of the questions you asked is it safe to use a menstruation cycle tracker app? I say no. Right. If you're going to go to any of these states where they are not friendly, Texas, Florida, the South in general, then I would not, and I actually put up a petition. It's turn up the volume.us/petition that if you don't respect my reproductive rights, I'm not going to college in your state. I'm not going to apply. I'm not going to bring my money. I'm not going to bring my brain. None of that, because it would be 1 in 4 people born with a uterus when they go to college is sexually assaulted. And then you leave the state to take care of your business, and then you come back to Georgia and they'll arrest you at the border. So that's not okay.
No.
It's just not okay.
No, that's terrible. That's terrible. Wow. That's pretty bleak. Pretty bleak. Man.
So bad. And that's now. That's now.
Yeah, that's happening right now. So what was the name of that, the petition? Yeah.
Yes. Yes.
What was it called again?
Turn up the volume, turnup.us/petition. And it's, if you don't trust my bodily autonomy, I'm not applying to your college. And anyone could sign it. And it's being sent to all the college presidents and the governors of each state. Because the example I give is my daughter is brilliant and she crushes on computer science. But will Georgia ever see my daughter at a college there? No. Will Texas ever see my daughter at a college there? No. Will Florida ever see my daughter in a college there? No. North and South Dakota? No. North and South Carolina? No. You guys will never see my brilliant daughter as a programmer in your state.
Yeah, it's kind of a secondary impact of these laws that you never really think about, but like a real brain drain effect happening there.
Yes. Yes. Yeah. And then my father I love him as a feminist. He's like, well, if there's no women in those states, there will be no men.
There you go. There you go. Yeah.
You lose all the hot, smart women. You won't have any men.
Think about that, guys. Jeez. So, I mean, okay. Also, access to care post-Roe. Been talking about all these invasive new realities, but if we could step back a little to the broader impact of no insurance, bad insurance on women's care. A recent survey just showed a shocking 92% of Americans who've delayed or gone without medical care because of concerns about cost. That obviously includes a lot of people who do have insurance. What's the long-term impact of an environment like this?
We really should go to universal health care. The bane of a lot of doctors' existence is the prior authorization. If you don't know, that means a doctor wrote a drug and the insurance said no. Don't blame the pharmacy, but do blame the pharmacy benefits manager, which is usually the owner of the pharmacy, unless it's a local pharmacy. But it's the United Healthcare, it's the CVS, etc. And they, if you haven't looked at the statistics, instantly just refuse 30 to 60% of claims. I don't even think they read it. They just refuse it. And the doctor's so defeated. They're like, okay. But you need a doctor who's willing to stand up and I'm going to fight them and try again. And then I'm in California, which is one of the most liberal states. They don't even have a peer-to-peer review process. We do not do peer-to-peer. And I was like, what? We know that you uniformly just deny stuff. And now they won't even put a name of the person who denied it. In the past, they used to own up and be like, I'm Dr. blah, 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 and my specialty is X, and I'm refusing this. Or they at least now put RPH, which is a pharmacist. But I was like, a pharmacist overrode a doctor. As a doctor, I write the prescription and you fill it. Where are you overriding me? And so we need a doctor to doctor. We need a same expertise doctor to doctor. You don't want an eye doctor talking about your uterus. You don't want a skin doctor talking about your, neck. You need a skin doctor talking to a skin doctor. Nobody should override me unless they know my field, right?
Yeah. Do you
need universal
do you feel
healthcare.
like that's profit driven, or is it just a measure to maximize profits? Yeah.
Absolutely.
It's outrageous.
I mean, I'm an entrepreneur, and we're not trying to make crazy money. We're just trying to make a little money to pay back our investors, and not crazy money. We've seen other people make crazy money. We won't do it. And I get it from the insurance side. Like, it makes sense. If I reject all of your things and you don't appeal, then that's on you. Har, har, har. But we as the problem is our employers pay it, and we as an employee don't have the power, the strength, the energy to be like, this insurance sucks, stop signing up with them, they keep screwing me. And the doctors can't talk to the patient and be like, your insurance sucks, please tell your employer to pick a different insurer. It's just like too many steps removed. And it's been shown, I went to UCSF, which I call the Berkeley of medical schools. And if you look at the math, if we went to universal healthcare, we could cover everyone, because those that don't get care and wait until they're crazy sick cost a lot more, and they go to the ER, which costs a lot more, and they block up stuff so the rest of us can't get care. So you may be rich, you may have insurance, and you'd be like, this isn't going to affect me. But the fact that the other states don't have abortion, when you have a miscarriage and you need something, you are 6 months out because all those people came from their state to our state. We saw a 7x increase in California for our abortion clinics from people flooding in. And when you, your daughter, your friend, your mother, your auntie, your sister, whatever need it, you can't, because you got 7x in front of you.
Have you had any experience with insurance co-ops with people? I've heard of this thing where people form co-ops, and they say, if you go to the doctor, if you go to the hospital, say, I don't have insurance. And then if you're a member of the co-op, you pay into the co-op, and the co-op pays the whole thing. Have you had any experience with anything like this?
I haven't had experience with that. And what's crazy, just so you all understand the way the system works, is there's a price, but the insurance company never pays that price. They actually have a contract that says we will only pay 30% of what you charge. And who gets charged that price? The person who doesn't have insurance. And does the person who doesn't have insurance have the money to pay that? That's why they don't have insurance. And so the person who's least able to pay pays the most. And that the insurance company is flying their jet. They have their MBAs. They're throwing money parties, whatever. They live in, they have rich things. They have lots of money. They get paid way too much. But the person who can't afford it is the one that gets the full bill. And oftentimes, hospitals will have a sliding scale and they can negotiate it. So please know that if you are paying cash and you cannot afford it and it's going to destroy you, please know that there is a financial aid department that can talk to you about payments or whatever. But really, it's this middleman insurance sucking up profit off of has to pay for their shareholders. They got to pay back their share. They got to maximize their share price. That is causing this
neoliberalism,
problem.
Baby. I hate it. I hate it so much.
National health care.
I was going to ask you. I mean, as a CEO, you have now advocated for universal health care. I'm a little surprised, but I know you got your doctor hat and your CEO hat. So I'm happy to hear, someone like you advocating for universal health care.
No, we've opted out of the insurance system. As I mentioned, we're only $35 once a year. And I work at a major academic institution, can't name them because they'll be irritated. And for every one physician, they have 4 full-time billers. And I was like, when I built this system, I mean, great, we're employing 4 people, but I don't want to pay for that overhead. I don't want to deal with all that just for $35.
Right.
Right. So much people working overhead.
You compare America's insurance system to countries that have universal health care, and the amount that we spend on the administrative cost, which is the cost of all those denials and the cost of all figuring out who pays what, is 30% of our entire system is all administrative fees, and it's like single digits, like 5%, 3% in other countries that have universal health care.
Yeah. And it prevents us from collective bargaining on the drugs, right? If we could bargain as a country, it's a very different thing than all these small little, people trying to fight the pharma that's just sucking all the money.
Yeah. Yeah, absolutely.
But there is a cool movement
please tell me.
direct primary care. So these are doctors that have opted out of insurance, and I don't know how they're doing it, but it's $35 a month, unlimited access to a primary care doctor. Doesn't cover catastrophic, so you still got to do that. But the direct primary care, I think it's an incredible thing. I haven't personally tried it. I'm a doctor snob, so I'm curious if they have, the ones that graduate the good med schools and the good residencies. But, maybe they do. That would be the only negative.
Yeah, that's fair. In some of my research, I was reading about fraternal organizations 100 years ago, your Knights of Columbus, your Moose Lodge. They would hire a doctor for that chapter of the Moose Lodge or whatever. And so every family that was connected to that Moose Lodge through the fraternal organization got to visit that doctor. And I mean,
wow,
we're to a place now where that makes a whole lot more sense, I think, than what this hospital system that we have.
Yes. No, the doctors do not like MBAs telling us you have to see a patient every 15 minutes. You have to document this. If you don't document this 10 items, then the insurance won't pay. It's just the hoops and loops. We just used to write notes and people would pay us, and I really think doctors, I've scared all of my family from going into medicine because I'm like, I did 12 years more education than my husband. He makes 10 times what I make. And people are suing me. People are telling me I have to do this and end up in jail. Like, I don't need that pain. He just programs,
Yeah. No, I mean, introducing the profit motive into medicine is just so crazy. I had a personal experience with my dentist. I went to a new corporate dental branch that opened up in my neighborhood, and I was like, give it a try. And, I've always had really great teeth. I've only had like 2 cavities my entire life. I'm almost 50. And then suddenly they've got, we found 2 cavities and we got to, we think you should do this and you should do that. They were telling my wife she needs a root canal right away. This is after the first visit. And it's just like, no, I have no trust that they're not just trying to maximize profits and squeeze every patient that walks in.
No, it's desperation, it's sadness, it's greed. I mean, when the head of the country is so greedy and his entire family and everyone that's elected around him is so greedy, that it's a reflection of our country.
Sad but true. Sad but true.
Stand up. Stand out. At Windy City Print Shop, you'll find original designs celebrating community, solidarity, mutual aid, and the belief that ordinary people can create extraordinary change. Resist with your whole chest. Windy City Print Shop. Visit windycityprintshop.etsy.com.
How has the landscape changed on sex education in this environment? I gotta imagine that it's not great.
Yes. I think we were moving forward with, liberal democracy, Democrats, and this administration wants people barefoot and pregnant. And so if you want people barefoot and pregnant, then no sex ed. If you want to prevent unplanned pregnancy, but then also prevent abortion, and if you want your people to be educated and rise, then you should have comprehensive sex ed. And the reason why I do what I do is as a pre-med in high school, 15 years old, I volunteered at Planned Parenthood and I ran pregnancy tests and gave results. So one day I run a pregnancy test, it comes back positive, and it's not me, it's a 13-year-old young woman. And I go in and I present her options. You can continue the pregnancy, continue it and give it up for adoption, or terminate it. And she's like, I'm going to continue the pregnancy. And I'm like, okay. And I turn her over to the social worker and let them, proceed from there. And I look at how different our paths were going to follow after that. She would become a statistic, a teen pregnancy, most likely to have low income, harder time to how is she going to graduate high school? How is she going to graduate college? Does somebody want to marry somebody that already has a child by somebody else? There's just like so many things that, and certainly you can do it. And so many women have, as a single mom, etc. But that just makes life a lot harder. And as I like to say, birth control and sex ed are so crucial for those of us who are born XX, born with a uterus, to get through higher education, because otherwise we literally have to be a saint. We risk pregnancy, and pregnancy will take you out of college. Pregnancy will take you out of medical school, residency, law school, higher education, PhD, CEOing. But there have been many women that have done it. I'm just saying it's a lot harder doing it pregnant when you don't want to be pregnant.
For real. I believe that.
Yeah.
Okay, so shifting gears a little, fibroids. Venus Williams discussed her debilitating experiences with uterine fibroids. She says her concerns were dismissed by her doctors for years. Awareness of this problem seems to be on the rise, but some women are still waiting years to get treatment. What's causing these fibroids? What do women need to know?
Yes. So what's shocking is I'm not an OB-GYN, but I do kind of outpatient gynecology with respect to pap smears, sexually transmitted infections, and contraception. And so I'm also doing menopause. And what's crazy is that the American College of Obstetricians and Gynecologists, ACOG, the national, international org for OB-GYN that we all trust, states that uterine leiomyomas, aka fibroids, occur up to 70% of women by menopause and 80% in Black women. However, 50% have no symptoms. So no symptoms, don't need to treat it, don't need to deal with it. 25% to 30% have symptoms that need and should be treated. And so those symptoms for people to know: heavy periods, pelvic pain or pressure, reduced fertility, because if there's some blob in your uterus, then it's harder for the embryo to stick. It pushes it out or it doesn't let it stick. I would say, depending on your age, if you're on the younger side, I'm all about, for any age, hashtag stop sucking it up. If you have bad, evil periods in any way, please see a doctor and get that treated. And if it doesn't respond to treatment, then work it up more. And the workup is generally a pelvic ultrasound or vaginal ultrasound to look and see, is there any lumps or bumps that there shouldn't be? And then you can either treat it chemically and try to see if you can calm it down, or if it's bad enough, you have to take out the lumps. And I had a friend who had like 50 to 100, and there's just no way you're going to surgically take out 50 to 100. Luckily, she was of the age where she was no longer thinking of having children. So the answer in medicine, just take out the uterus. And I get it. If there's like 50 to 100, that is the answer if I can't treat it with all the drugs, that I try to treat, or try to zap it by killing it or burning it or stuff like that. And so the risk factors are hypertension and obesity, but that's, older people, not a hale, very athletic, energetic Serena Williams. That's not hypertension and obesity. That's like crazy healthy. And what's interesting that's protective, is many children, maybe it keeps the hormones in a happy way. However, the cool part, my thing, birth control pills also decreases your risk. And the way I explain that is when you're on the birth control pill, your uterus, the lining, it doesn't grow as much. So without the birth control pill, or if you're pregnant, it's doing other stuff, the lining of your uterus. But without the birth control pill, every month it goes up and it goes down and it goes up and it goes down. And so it's stimulating the tissue here, which is where the fibroids grow, up and down. And so the fibroid can grow up and maybe it doesn't grow down. But with the birth control pill, it's just, it's like a level 3 versus going 10, 0, 10, 0. But with birth control pills, it's just like 2, 3, just kind of sits there. So that would be my hypothesis, is that the estrogen, progesterone is just keeping things stable. None of this growing up, growing down, which could stimulate a fibroid for that to happen.
Fascinating. It makes a lot of sense to me. Do you think diet is a factor in the growth of these fibroids and them becoming such a larger issue these days?
Well, definitely, we know that obesity is a risk factor. And I also know that with more fat cells, there's more peripheral aromatization of your male hormone to female hormone. So know that everyone has estrogen and estrogen and testosterone. But those people that have more fat, the testosterone can be turned into estrogen. And I believe the estrogen stimulates the fibroid growth. And so if you have excess weight, then that can stimulate that excess growth. Also, family, history, and a little bit of genetics. Know that fibroids are 2 to 3 times higher amongst Black women than white women. And Black women develop them earlier. They're more likely to lose more blood, and they're a lot more likely to have bigger uteri, which are filled with bigger fibroids. But they attribute that mainly to systemic racism being blown off. Oh, suck it up. That's just life. Oh, being a woman is pain. And then social determinants of health, getting access to a doctor.
Yeah. And I mean, I kind of gotta, I feel like there's, I feel like a lot of women, they want a female gyno, right? Like you don't like nothing against male gynos, but like, it just makes sense. So how are Black women approaching care? Do you see in your experience that they're looking for Black doctors to maybe get that extra level of sensitivity and sympathy?
I can't speak to, the experience of all Black women, but definitely as a minority, it's always nice to have someone you feel that understands you, won't blow you off, understands what it's like to be. I mean, if you all don't know, and I hope we will erase this, but like there was a time in medicine when like, oh, Black women don't feel pain as much. Like, what? Like, you just don't assume that. I treat everybody, the same. And then you need to know who's more sensitive, but don't assume anyone doesn't feel something. That's just, uncool. And women, as you know, have always been called hysterical, meaning hysterectomy. Hysterectomy is getting rid of the uterus, but hysterical means you have a uterus and therefore you're messed up and kind of crazy. And so there has just been all of that. All that to say that we need more people of color as physicians. That the other key for you to understand is people can't pick their doctors. They just want a doctor. If you don't know, we just did a secret shopper for peri/menopause. It's a year wait to get into UCLA. So you don't get to pick your doctor. You just want whoever knows peri/menopause and will take you. You're just desperate. And then for Stanford, it's a 3 to 6 month until clinic and then an unknown period for their wait list. And we tried calling UCSF and there were so many barriers there as well. So to think that people even get a choice, some people, just go to local federally qualified health clinic, which is great. And there are a lot of people of color giving back to their communities. But I could also see the flip. You're the only person of color. So your job is to go out there and make as much money as possible and give back to your community in that way. And therefore, you may not see, people of color as much. It just, but for people to know, I looked at the statistics and it looks like about 8 to 10% of OB-GYNs are Black, and the general population Black is 13%. So one could say it's only 3%, but one could also say it's 30% won't get what you want if you wanted it. But even then, it's who knows how it's distributed, stuff like that.
Yeah, those are great points. Thank you so much.
Hi, this is C.K. Morris, the author of The Shadow Family. If you like horror, action, comedy, if you enjoy skin-crawling, gore-soaked mayhem, grab a copy of The Shadow Family and check it out for yourself.
Buy your copy on Amazon today.
I would like to go back and talk a little more about birth control. Doing my research for this episode, I listened to a few interviews with you, and there's some really interesting things that you brought up in your other interviews. One of them is that periods are kind of optional now in this modern era of medicine. Can you walk us through that?
Yeah, thank you so much for doing that. I really appreciate you investigating. My gift to the world is really anybody born with a uterus and that is bleeding every single month. That is so 2020. we now have drugs and we have science, and you don't have to do that. And it's not just because I'm trying to push birth control pills, really. I just want I realized in trying to get pregnant with my daughter, the only reason that we all bleed every month is we build up that lining and we're like, embryo? Oh, no embryo. Bleed. And then we build it up again. And then we bleed and we build and bleed and build and bleed from 12 and a half to 52. 40 years of this every single month. And there's an article by Malcolm Gladwell called John Rock's Error. And in it, he interviews this medical anthropologist, Beverly Strassman. And she found out that the Dogon tribe in Africa, which dies the same age we do, 70-ish, has 100 periods in their lives. We have 350 to 400. So we have enough periods for 2 other people. But most importantly is that it's because they have 8 babies. How many periods do you have when you're pregnant? 0. How many periods do you have when you're breastfeeding every 2 to 3 hours? 0. And so times 8 babies, you get 100 periods. And every time you build that lining, it can turn into endometrial cancer because it can mutate. And every time you pop an egg, and we now think it has to do with the tubes, but pop an egg, irritate the tube, then you increase your risk of ovarian cancer. And then lastly, the colon is right around the uterus. And the way I like to think of it is the uterus is like up and down, and the colon's like, oh, I'm sad for you. And it either runs faster, diarrhea, or it runs slower, which is constipation. But by messing with the colon, you increase your risk of colon cancer. So by stabilizing your hormones and not going up and down every month, you decrease your risk of ovarian, endometrial, colorectal cancer. And then for anybody who is pre-med or pre-health, the question we love to ask med students on OB-GYN residency is, what is the number one cause of anemia in a menstruating person? What do you think the answer is, Scott?
Bleeding?
Exactly. So if you eliminate the menstruation, you eliminate the anemia. If you eliminate the M in PMDD and PMS, you eliminate PMDD. You eliminate PMS. And so, and then we have a couple initiatives. I have a TEDx talk. It's at the bottom of pandiahealth.com/periods optional. And it's a longer version of what I just did here. And then we're also, women's sports is becoming very popular. And as a Tiger Asian mom, are you going to do better at soccer, gymnastics, basketball, running around on your period or off your period? I'm pretty sure off your period. And know that Megan Rapinoe got all 3 of her ACL tears on her period. So if we eliminated period, maybe things would be different, right? So go to performperiod.com, and we have a free lecture that I'm happy to give. If you have a sports team that can get together 100 people that want to hear my Zoom talk, I'll do it for y'all. And then we also have a set of slides that you can look at all the different athletes who have complained about their periods.
Yeah, I'll be sure to link that in my show notes when I post this podcast. There was a little detail that I loved when you were describing this, that the doctor who developed the birth control pill, a man, was a Catholic, and that's the reason why women have to bleed every month with the birth control pill. Could you recount that story for us?
Yes. So the title is John Rock's Error. And he was an OB-GYN, and there were 2 PhDs. And Dr. Rock insisted that women bleed every single month. And the other 2 PhDs were like, why? Women can bleed every 3 months, every 6 months, it could be never. Why are you making it every month? And he's like, I'm going to get this through the Catholic Church, and I'm just going to make periods regular. Because we always forget that in the Catholic Church, it's fine to abstain from sex during your fertile period. And if you could make their periods regular, then they could avoid the fertile period perfectly. And he got it through the nuns. The nuns are always very liberal. He got it through the priests. I don't know how. And then it hit the Pope. The Pope was like, eh. And so because John Rock won that argument against the 2 PhDs, Every method since has had a bleed 1 week out of 4 because he was trying to get it through the Catholic Church and he failed. They also thought women could handle it if we didn't bleed every month. And I was like, how about you ask women if we can handle it or not, rather than you assume.
Pope blocked. That's terrible. But I'm so excited now that that science is caught up now and that we don't have to have it that way. That's wonderful. There was one other fact that you brought up in one of your other interviews that I didn't realize, which is how the percentage of women who are actually using the birth control pill for birth control is smaller than you might imagine.
Yes. So know that 30% of people using the birth control pill are not using it for birth control. They're using it for painful, heavy periods. They're using it for anemia. They're using it for acne. They're using it for endometriosis. They're using it for polycystic ovarian syndrome, now called metabolic syndrome, PMOS. I forget the exact phrase for that. It's new, so I'm learning it. And people with cancer, leukemia, lymphoma, if they're going through chemo, they don't have platelets. If they bleed every month, they will bleed like a murder scene, and then we will have to transfuse them more blood. And so there are so many reasons to use birth control, not for birth control. And so if they take away birth control because they're not scientists, they don't understand the unintended consequences. What will we treat PCOS with? What will we treat endometriosis with? It is simply estrogen and progesterone. And so one thing that I've proposed and I have yet to do is going to be my version of, a modest proposal, but in a flipped way, is that we don't call it oral contraceptive pill. We call it estrogen progesterone pill, because that's really what it is, and take away the stigma of contraception, though I don't think there should be a stigma for contraception. People should be proud that they're preventing unplanned pregnancy and preventing abortion and planning their families and how many children they want.
Yeah, it's so vital to women's equality, I think, is having that control in your life. I mean, that's a huge fundamental question. But that's amazing that basically 1 in every 3 women on birth control isn't even taking it for birth control. So we should definitely start calling it something else. I think that's a great suggestion.
Yes, estrogen, progesterone pills, hormone therapy, though, this administration is flipping out on hormone therapy unless it's testosterone for the troops, because who else do we want to be jacked up and angry, right?
Yeah, absolutely. All the armed people.
Steroid rage.
I've made it through my list of questions. Are there any other things that you would like to add before we wrap up, Dr. Yen?
Yeah, thank you for asking that. Hashtag stop sucking it up. If you have bad, evil periods or peri/menopause, see a doctor, get treated. Hashtag periods optional. If you're bleeding every month and you don't want to be, know that we can turn it off, and generally it will decrease cancer, increase your quality of life, increase performance at school, work, and sport. And then the top 3 myths about birth control, I'm just going to hack down right now. Number 1, it makes you sterile. The joke is, while you're taking it, that's why it's birth control, but it's out of your system. And the way you know that it's out of your system within 3 days is there's 3 weeks of hormone usually, and then 1 week of placebo. And on that 3rd day of no hormone, you bleed. And that's because the hormones have left the building. If you want to be anal retentive, it'd be 3 half-lives. So it'd be like 9 days. And if you want to be really anal, give it 2 weeks. But it is out of your system. And once you bleed and build back up, you can get pregnant again. It doesn't make you gain weight. They've shown research that you have 100 women on the pill, 100 women not on the pill. The women on the pill average 1 pound less, because the women not on the pill bloat up, bloat down, bloat up, bloat down. And so they average weight more. But certainly if you notice when you take the pill, it gives you munchies and zits, then no, don't take that one. But also know that there are 40 different pills, 8 different progesterones. And if one pill doesn't work, there are 39 other pills, or at least 7 other progesterones. And that Pandia Health has an algorithm for picking the best pill for you. And then the 3rd myth about birth control is it gives you zits. Actually, anything that has ethinyl estradiol increases sex hormone binding globulin, which binds testosterone, and it's the testosterone that's giving you zits. So if we bind that testosterone, then we decrease your zits. So any birth control pill should decrease your zits. But again, if you use a particular one and gives you more zits, don't use that one. There's 7 other ones that you could try. And then with HRT, I think there's so much stigma. Medicine ceded HRT to the alternative medicine people for 2 decades. And now we got to fight our way back with science and evidence. Know that HRT is affordable. Don't let someone talk you into compounded or pellets. Pellets are crazy and more expensive because they're customized. We have FDA approved, FDA tested, bioidentical estrogen and progesterone. It does not increase your risk of breast cancer. And we can do that on a different talk, or you can check out my TikTok. And that's the key to take home. If your doctor says that HRT estrogen increases your risk of breast cancer, they are not up to date. Give them the book Estrogen Matters by Aaron Blooming, who's an oncologist whose wife and daughter both have breast cancer. And he will explain to you the Women's Health Initiative, the flaws with it, and why estrogen is not the cause of increased breast cancer. We believe it actually decreases your risk of breast cancer by 22% and decreases your risk of dying from breast cancer by 44%. We now believe it's synthetic progesterone. And for HRT, we no longer use the synthetic in general. We use the bioidentical micronized progesterone, which again is not compounded or a pellet. It is $10 a month. So if anybody tries to sell it to you for more,
So many X's, so many buzzers.
Yes.
Okay, so let's tell my audience one more time where we can find you and where we can learn more about Pandia Health and sign up for it.
Amazing. So Pandia Health is the Greek goddess of healing, light, full moon. But to help you remember how to spell it, I made up the definition. Pan is every, dia is day. We want to be with you every day from your first period, 12 and a half, until your last breath. So pandiahealth.com. And then all the socials, we're at Pandia Health. If you're interested in menopause, we have at Pandia Menopause. And then I'm building my TikTok and Insta. So if you want to follow at Dr. Doctor Sophia, Sophia Yen, Yen. I'm having fun with TikTok and I'm learning to port it over to Instagram.
There you go. That's great. That's wonderful. I will make sure to tag you on all of our posts as we parcel out social media posts from this interview.
Love it.
Wonderful. Well, Dr. Yen, thank you so much for coming onto my show today. It was a wonderful discussion, and you are a live wire, sister. I loved you're packed with knowledge. Thank you so much for sharing all of your knowledge with us. I really appreciate that. And I will end this episode the way I end all of my episodes by saying, let's make them pay. What is Substack? It's like the greatest newspaper that ever existed. Completely decentralized. So many talented writers and artists in one place. The roster is stacked. Substack is similar to other social media platforms, just packed with incredible talent. Some of my favorites: Michael Ian Black, Nana Bacon Aguirrewa, Adam Coleman always gets my attention. Fantastic journalists like Radley Balco, Hamilton Nolan, even living legends like Seymour Hersh and Chris Hedges. Cultural commentators like Jamila Jamil, Holly Solemn, Caitlin Johnstone, and Nathan Rabin. Visionaries like David Shing and the Peaceful Revolutionary. Substack has about every possible genre you can imagine. There's a feed like Twitter. I like Substack's feed way better than X. You can find vertical videos like you see on Instagram Reels or TikTok. You can scroll through this feed and click the links to find excellent articles, one after the other. News stories, analysis, criticism, fiction, poetry, visual art, it's all there. If you're a reader, you should be on Substack. If you like being informed about what's happening in the world without an editorial staff getting in the way, you should be on Substack. Decentralization is democratic. Decentralization is the future. Decentralization means everybody's posting. Everyone who gets a Substack account has the option to start publishing. It's kind of like having your own blog, but that blog can grow into its own masthead with paid writers on staff. Centralization is what we see in mass media. Just 6 massive media companies own about 90% of the marketplace. Everything that's broadcast from these channels is filtered through the perspective of their billionaire owners. What does Rupert Murdoch want? What does Jeff Bezos think of this editorial? Media companies are top-down authoritarian organizations. As such, they will always reflect the biases of their owners. We can see top-down changes happening at CBS right now. Barry Weiss and Larry Ellison have delivered a fatal 1-2 knockout to CBS News' journalistic integrity and hard-won reputation. Substack doesn't have editorial control or centralization. Substack's writers have journalistic freedom. It's like every person on Substack has their own printing press. That's decentralization. My content gets attention on Substack. Subscribing to letsmakethempay.substack.com is the only way to avoid suppression of my content. That's because every post I make is sent out as an email. This makes it easy to make sure you never miss a post and allows you to go back and watch or read it again. Every writer on Substack has ownership of their email list and can take it with them. Substack also makes it super easy to monetize your content. That money is not dependent on some creator fund or algorithm. A subscriber pays, Substack takes a small finder's fee size cut, you get your money. Easy peasy. Fair too. Decentralization. So check out Substack today, a really worthwhile platform. Maybe consider publishing a little content of your own. Flex some creative muscle. Download the app or go to letsmakethempay.substack.com to get started. Let's make them pay. All right. Fantastic.
Thank you so much. That was a lot of fun.
I had fun too. Thank you, Doctor.